There are 6 dimensions that make up well-being.
Hi everyone, our topic is on exercise and well-being. Specifically, the benefits exercise has on psychological well-being.
There are 6 dimensions that make up well-being. The first one is self-acceptance, which is the positive views of oneself. The second one is positive relations with others, which is trusting, caring, and empathic relationships. The third one is autonomy, which is self-determined with intrinsic motivation and self-reference standards. The fourth one is environmental mastery, which is effective mastery of the environment to fulfill personal values. The fifth one is personal growth, which is sense of development and self-fulfillment over time. And then the sixth one, which is the last one, is purpose in life, which is directed toward purposeful goals for living. Reducing anxiety and depression with exercise. Exercise has been proven to lower anxiety, depression, and chronic disease symptoms, while also improving emotions of well-being, relaxation, and overall health. Physical exercise has been linked to improved mental health and well-being. Exercise has been linked to a reduction in stress emotions, including state anxiety. And exercise has been linked to a reduction in mild to severe depression and anxiety, which are common symptoms of a failure to cope with mental stress. This is just a brief video of Lara, an exercise physiologist, which she talked about how exercise helped manage mental illness such as anxiety and depression.
Hi, I'm Lara, an exercise physiologist at the Mount Barker Clinic here at MyPhysio SA, and I'm going to be talking to you about mental health and the benefits of exercise. To clarify early on, exercise doesn't mean you have to run a marathon. It's simply any activity that you enjoy doing. So that whether that be taking your dog for a walk along the beach or catching up with a friend to do a class or even socializing with a family in the park. As an exercise physiologist, we can help you with mental health problems such as depression, anxiety, or if exercise makes you feel good as it releases chemicals such as endorphins and serotonins to help improve your mood. When you exercise, it reduces your stress and the symptoms that you may be experiencing. The trick to exercise is finding something that you really enjoy doing and that you can commit to. So whether that be like a 5-minute walk up and down your street every day, that's a really good start.
Now, there are a lot of psychological benefits that exercise holds for adults. Exercise increases our confidence, our assertiveness, our memory, our perception, our well-being, as well as our body image. Now, with this, exercise also decreases a lot of things. It can decrease our anxiety, our anger, depression, phobias, tension. And it's kind of mind-blowing to see just how big of an effect exercise can have on us. All right, so now I'll be discussing the psychological benefits exercise has for children and adolescents. Now, exercise increases their levels of self-efficacy, as well as their achievement motivation, their intentions to exercise, as well as lowering levels of depression. Now, as well with this, it's important to note that the amount of exercise is in fact related to their perceived body attractiveness, hence the importance of appearance and self-worth. And this is very present in adolescent girls. Now, researchers also explain that the potential psychological mechanisms for positive effect of exercise is due to their enhancing of, they feel that they're in control, as well as improving their self-esteem, and allowing them or giving them more opportunities for fun and enjoyment.
Exercise is important for self-development. It affects self-concept, self-esteem, and self-efficacy. Self-concept is seen as the most important measure of well-being because it is the combination of all aspects in our life. Self-esteem is improved through exercise because the individual is perceiving improvement. It also boosts competence and self-worth, which thus helps improve self-efficacy. In the book, they mention a study on the effects of exercise in women going through menopause. The study states that women with higher self-esteem had less symptoms. The women that had lower self-esteem showed to have lower quality of life. The study also describes how exercise helps improve self-esteem because it affects how women perceive their condition and their body attractiveness.
In the National Institute of Health Medline magazine, we highlight Kevin Love's struggle with anxiety and depression. In the article, Love opens up about his mental struggles and what has been helpful in dealing with anxiety and depression, like working with therapists, taking medication, meditating regularly, sleeping well, taking care of his diet, and exercising. While Love exercises in his training to play in the NBA, he completes separate exercise to focus on his psychological well-being, specifically stating exercising makes him feel good and blow off steam. Blowing off steam helps regulate his mood, while feeling good after exercise improves his self-esteem.
Using exercise as an adjunct to therapy. Now, according to our book, research has in fact shown that exercise helps reduce negative psychological states, as well as aerobic exercise relating to enhancing one's self esteem, mood, and our levels of work productivity. Now, with this, exercise therapy does give physiological benefits like increasing one's cardiovascular endurance. And exercise would be beneficial to cardiac patients, especially ones struggling with depression, as depression has been linked to future heart attacks. And now, research also shows that exercise and cardiac rehabilitations decreases things such as depression, anxiety, as well as other aspects. Now, it's important to note that although exercise is a very important tool, it's one that shouldn't be used in all cases of emotional disorder. An example being that aerobic exercise therapy would not be best for those who are obese or those with severe heart disease, as well as those struggling with high blood pressure.
Our discussion question is, has exercise helped improve your psychological well-being? In what ways has exercising helped you, and what activities do you do?